What'd you think? Impressive, disturbing, terrible way to start your 9 o'clock class, walking through poo.
Is there like any data to back up his stuff, or did he just kind of like send it and over to the side of him?
So I am pretty sure that he knows the types of worms that he's been infected with. I think there has been stuff like that. I mean, so the video, they're like, oh, there was this documentary and it indicating some of this stuff. There has been multiple accounts of some of these situations. If you search helminthic therapy, he'll be on there for sure. But there are other people, and there's other YouTube videos with people that are growing up their own worms. And I mean, it truly depends on the type. Some of them, the larva, you get this package, and the larvae are on some little gauze pads that you put onto your skin and allow them to do their job. So I feel like some is going on here. We're on there. I'm like, wait a minute. So there are things that back it up, but we're still pretty young in the idea of trying to deal with something like that, which I don't know. I feel like if I had some sort of autoimmunity, I think I would be reaching out to this guy, be like, could you ship me something? Right? Just to see. I don't know. So I'm pretty sure we left off right here, if I remember right. We were talking contact dermatitis, poison ivy, oak, things like that. And the TB test, also a delayed type hypersensitivity reaction. So there are lots of things, and it kind of makes me think back to the video. Jasper probably didn't have allergies to pollen and grass and stuff like that as he started his career as a landscaper, but through repeated exposures to these substances, his body had the opportunity to mount some responses against it, developing some of these allergies. And there are numerous situations where these things can happen. The poultry worker over here, all of these chickens, poultry workers' lung, I'd like to call it feather lung. All sorts of different stimuli through occupational exposure. Working in a laboratory with lab animals, the dander, the urine, all sorts of different things have the potential to set the stage for allergies to develop. And it may be a situation where you are good to go. And, 15 years into your studies, that's when these allergies start to result. I worked with, when I was a graduate student, my advisor worked with rabbits, immunizing rabbits. We would collect sera from the rabbits and look at antibody production, or maybe the lack thereof, just depended on the situations. And that happened to him. Ultimately, over the course of his studies, working here for decades, he developed some pretty severe allergies. And simply walking into the room where the rabbits were housed, he would have an allergic reaction, and his eyes would be all watery, and he would wear a mask. He would still deal with it. All right. But there are definitely situations where you just switch it up, no longer working with it. I look at this one and my stomach just says, yum. Look at all that cheese. Delicious, unless you hate cheese. And then I question, who are you? This, another potential. And cheese, all sorts of different things to help produce the cheese, bacteria and some molds. And in some of these instances, some of these molds can be antigenic, stimulating an allergic reaction, and ultimately cheese handler's disease. bad news. So what we've thought about so far, hypersensitivity reactions, and as I said, 4 different types. The first 3 of them are humoral or antibody mediated types of hypersensitivity reactions. And the last one is the cell mediated, T cells involved instead of immunoglobulins. All right. So multiple things happening. We showed some examples of each of these as we move through. So the first and the third, it's antigens, soluble antigens that the antibodies are able to recognize and we mount responses. The second one are these cell-bound antigens. This is those transfusion reactions, the antigens on those red blood cells, stimulating these types of reactions. And so the examples down below. Allergies, hay fever, whatever, red cell destruction through transfusion or attacking the unborn child, resulting in the hemolytic disease. The third ones are those immune complexes. So antigens and antibodies that have linked up, forming these complexes, and then winding up docking onto some tissues that stimulate either natural killer cells or complement or both to come in and cause issues. So the glomerulonephritis, rheumatoid arthritis, lupus fits into this category as well as a type 3. Are delayed type 1s, the poison ivy, diabetes, type 1 diabetes, and MS fit into this category. All right. We will think a little more about some of that here in just a second. So in some instances with some of these allergies, and I'm assuming in Jasper's case, where they spouted off a whole list of things he was allergic to, they do some skin testing where they inoculate, they inject under the skin small quantities of these allergens, potential allergens. And if the individual reacts to these molecules, we see this wheal and flare. So redness, inflammation, together, the wheal and flare kind of welting up. It sort of looks like all of them, but really this one is what we're looking at. I believe we're looking at the forearm on this individual. My gut said to me, this is kind of odd. I've never had allergy testing, but I thought they did this on your back. Yes, have you had allergy testing? Did they do it on your arms too? Just your back? And do you have allergies? A lot of them? Would you get a worm? No. Okay. Anybody else? Anybody else thinking, man, I want some worms? Nobody. Dang it. All right. So multiple welts. Are you allergic to a lot of things? Okay. Interesting. You're probably not thinking interesting, right? Not so good. All right. So that's the idea with that. Okay. I want to tell you, and I'm not going to shift it up. I'm going to move through here because we don't have a whole lot of time. This next chunk of material, there is a table in the text that goes through all of these specific ones, providing some good detail. I recommend that you look at a little of that as you're moving through. All right. There is good information within there. All right. So we want to shift over and think about some of the autoimmune diseases, instances where, there's lots of stuff that we've already talked about, where our body is trying to do surveillance and look at our own cells and say, these cells are mine, I'm going to leave them alone, right? In a perfect situation, all of that would be functioning properly, and we wouldn't be thinking about any of these instances, all right? But sometimes we have cells that end up recognizing our own tissues, whatever it might be. Different things can be recognized truly as being foreign, but they're our own. And it sets the stage for some of this autoimmunity, or we're targeting ourselves. All right. So there are differences that we can see here, and the chapter provides more detail than my PowerPoints truly are. I can tell you that for sure. All right. So your thyroid, there are a couple of different potentials that can be acting on the thyroid. We can see hyper and hypothyroidism, all right? So over or under activity, respectively, all right? So the goiter that we're looking at here, this is a hypertrophy, so an enlargement of the thyroid. And this can be a symptom of Graves' disease and Hashimoto thyroiditis, the goiter. All right. There is also the potential for some bulging eyes. I wish we had maybe a little bit of a profile instead of a head-on, because the eyes really kind of are protruding out more. This looks like someone just scared the crap out of them, right? Maybe saw a ghost, right? Who knows, right? But this, another potential symptom that we may see, all right? So Addison's disease, there are numerous things that are being targeted in Addison's disease. We think about nucleic acids impacting numerous issues within the host. Mitochondria get affected. There's, you know, kind of tiredness, lethargy, lots and lots of other issues. The hyperpigmentation, pinkish looking palms can be an example of that as well. Lots of problems. And in these instances with the Addison's, it's adrenal glands that are being impacted. They like a little cap on the top of your kidneys or where the adrenal glands are. And so that definitely impacts lots of things. I believe, if I remember properly, JFK had Addison's disease, had some issues. And from what I was told, he found a doctor that was helpful to him. And this doctor was providing some injections, and it gave him a lot of energy. All right. What he was getting was amphetamines. And it provided a tremendous amount of help. He could get a lot of crap done, right? And in turn, he told many of his friends about this doctor as well. And they found some benefits as well, if you will. And in turn, they called him Dr. Feelgood. All right. And Motley Crue has a little song about him. All right. Deep down, it all comes full circle, right? Interesting. All right. Who knows? So myasthenia gravis, this is almost like the where we were talking about botulism and tetanus a while back. Seeing this image, it's not the same stuff, but it makes me think a little bit about it. All right. So in a normal situation, we're dumping out the acetylcholine, linking up to receptors on the muscles, stimulating the contraction. But in myasthenia gravis, we get basically paralysis. Antibodies that link up and block the activity of the acetylcholine, so they can't come into those receptors and actually stimulate that. All right. Blocking those receptors on the muscle cells. This image, and I want to assume it's the same, right? This is an image of rheumatoid arthritis, so targeting the joints, oftentimes the hands, but it can be wherever. And this distortion that you see is the result of the joints. And just looking at this X-ray, I can only imagine how painful this truly would be. So lupus, as I mentioned a second ago, within that type 4 category, there are numerous things that can happen in these situations. Symptom wise, we can see this rash over the face that sort of looks butterfly shaped, going up over the bridge of the nose. There can be ulcers that are in the mouth and nose. Then we see bigger problems. All right. Muscle pain, inflammation of the heart, poor circulation to your fingers and toes. There's problems with the kidneys, potentially serious problems with the kidneys, potentially lending to the need for a kidney transplant or dialysis. Lots of problems with lupus. All right. And this image over here, you can kind of see a hint of that rash over the face. So I know this is the end, but another one where I mentioned there's a lot that's kind of lacking in the last chunk of this chapter. We kind of just scroll right through it. All right. This bit is thinking about autoimmune diseases. And there are different types when we think about this. There are primary and there are secondary autoimmune diseases. A primary would be what we're seeing right here. David Vedder had SCID, which stands for severe combined immunodeficiency, basically born really without an immune response. All right. A secondary type of immune disorder would be HIV. And that is secondary because in this case, the primary one, you're born with this. You've got a genetic anomaly, a mutation that basically makes these stem cells not produce the proper cells that they should be. So you don't recognize things like you should. With HIV, the virus is targeting these cells and wiping them out. So it's a secondary. It's not genetically the result. All right. And there are numerous ones that we can think about. There are others besides SCID. Wiskott-Aldrich syndrome is another one. I think not quite as severe as this, but it is still definitely an issue. All right. There are ideas about, and we talked a little bit with our molecular biology stuff and genetic engineering. There are ideas about gene treatments, gene therapies, where we could potentially cure specific genetic disorders. All right. There are some potential issues with this. All right. So David was born in the kind of mid 1970s, maybe early 1970s. I don't remember the exact. And he had this disorder. They recognized this very early that he had these problems. And basically, from the time that he hatched out into the world, he was kept in a very sterile environment, hence the Bubble Boy name, right? He lived in this kind of tent that was sterile. He didn't have contact with anybody, no actual physical contact. There were in his tent these gloves that could go in there so people could kind of try to give him a hug or interact the littlest bit, but no actual true physical content. Anything going in there was sterile, right? Because anything could ultimately cause him to become ill and not recover, all right? So the hopes at, we're understanding stuff in the early 70s about DNA figuring out ways to kind of manipulate biotechnology is truly just in the infancy. But we understand some of these potentials to be able to do things. And the hopes were, we're going to find a cure for you, David. Just be patient. He lived in his bubble for just over a decade. I think he was 12. All right. That's quite a long time to live like that. All right. NASA built him a little space suit so he could actually crawl out of the bubble and maybe do a little bit of stuff outside of that sterile environment. He's in his own sterile environment. All right. Uh, so I assume it was lots of counseling, talking, realizing that there really isn't any cure in sight. And David decided, I think, along with his parents, maybe this is enough. And he crawled out of the bubble, hugged his parents, got sick, and died. Super sad. There's there's a couple movies, one going way back, all right? But interesting, all right? A couple of years later, a child was cured of SCID, all right? Which just seems terrible, right? You're like, dang it, if could he have just waited, right? So we saw some promise. And then we also saw, still trying to do some of this curing, some children dying instead of being cured. With these genes of interest not going into the proper cells or whatever it was, different types of cancers developing as the result of some of this. And truly, when we think about medicine, we try to help, not harm. And these therapies seemed to maybe be harmful. So the brakes truly were slammed down. We're like, we got to stop doing this. All right. Curing right now is something that we're not thinking about, but treating is a different situation. So with gene therapy, instead of trying to truly target those stem cells and give them the proper gene, we try to target and this not the stem cell, but the other cells that have differentiated and give them the proper copies. Those cells are short-lived. And so it's not something that is curative, it's a therapy. And you get repeated transfusions, fixing those copies and putting them back in. There are children with SCID, Wiskott-Aldrich, and a handful of others that are receiving gene therapies and are able to not be in bubbles, right? Because they have a functional immune response. But it's not something that we have cured by targeting those specific cells. I feel like with so many advances, like the recognition of what CRISPR can truly do, potentials for cures, I think truly can be on the horizon. But right now, we're still not 100% ready to say we could do this, all right, without potential serious side effects, all right? Truly kind of crazy. I had a friend that had multiple sclerosis, if I remember. I think that's what it was. This was many years back. He had hopes that there was going to be some sort of therapy, and there were hints. I can't remember where it was, someplace back east, that was going through some trial studies. And he was ready to go to get some therapy. And right before he left, he had a stroke and couldn't go and basically got taken right off of the list. And a couple of weeks after all of that happened, some kids in that study started to die. So, not the best in either situation for him, but he didn't end up getting the therapy. Kind of crazy. All right. So I know that there's other details in there talking a little bit about some of those therapies, and it does flip back to some of that biotechnology. And we can think about using a viral vector that targets a specific type of host cell to give those cells the specific information. And like I said, we think of that now more as a therapeutic, not curative situation. But maybe soon we may be thinking of it another way. All right, that's all I have for you. Questions or concerns? Okay, test will open in 15 minutes. I know someone will be on there at 10:01. Anybody? Not in here. Oh, I'm seeing it yet. You're like, yeah, I'm gonna do it. All right. Early bird. It's good. Okay, have a good weekend. We will start with infectious disease Monday.